Good morning all. In this lecture we will discuss about the submandibular region and innervation of salivary glands. Following objectives will be covered in this lecture. We will begin with submandibular region. As the name suggests, it is located below the mandible. You can see here, this is the region called submandibular region. It is bounded by following structures. Above, it is bounded by base of mandible. Anteriorly, it is bounded by anterior belly of digastric muscle. Posteriorly, it is bounded by posterior belly of digastric muscle and stylohyoid. Below, it is bounded by hyoid bone. Why you should know about the boundaries of submandibular region? Because here you can see various important structures. We will study all these important structures under the heading called contents of submandibular region. We will see these structures in the next. So what are the contents of submandibular region? So you can see them here. I listed. First, there are muscles in this region. What are those muscles? Digastric muscle. As you know, it consists of two bellies, that is why it is named digastric. Mylohyoid muscle, geniohyoid, stylohyoid, genioglossus, hyoglossus and styloglossus. So I will try to show all these muscles in the coming slides, and also you can able to see these muscles from the practical videos. In this region you can see two exocrine glands. They are submandibular gland and sublingual gland. You can see in the picture here, this is the submandibular gland and this is the sublingual gland. You can see three important nerves. I will be discussing about these three nerves in detail in the coming slides. The lingual, hypoglossal and glossopharyngeal nerve. And here in this region you can see one important ganglion, which is a parasympathetic ganglion called submandibular ganglion. You can see here at this point of time, I can show you here, this is a submandibular ganglion. Of course, I will be talking about this ganglion in detail later. Then you can see the two important arteries, lingual artery and facial artery. And in this region you can see the submandibular lymph nodes. So these lymph nodes are located in the superficial fascia and also close to the deep fascia in the submandibular region. And the name of the lymph nodes are submandibular lymph nodes. So we will try to see these contents one by one in the coming slide. We will discuss first about the submandibular gland in relation to its position, capsule, parts and also relations. We will begin with the position. It is located in the submandibular fossa of mandible. Where it is located, the submandibular fossa, what it is? So it is a part of the mandible. I am showing you, this is the mandible. The mandible has two parts, as you know. This is the ramus and this is the body. So in the internal surface of the body, in the lower part you can see a space or a depression. So this space or a depression in the mandible is called submandibular fossa, where the submandibular gland is located. And this gland, it is covered by a protective layer which is derived from investing layer of deep cervical fascia. As you know, the deep fascia of the neck consists of three layers: investing layer, prevertebral layer and pretracheal layer. The investing layer, as the name suggests, it closely invests or covers the submandibular gland and forms a capsule for the submandibular gland. The gland is roughly J-shaped. You can see here it is roughly J-shaped. In the J-shaped structure, the bigger part is the superficial part and the small part is the deep part. And these two parts are separated by a muscle. This muscle is called mylohyoid. So this is the image showing the two parts of the submandibular gland separated by the mylohyoid muscle. So here also you can see the two parts of the submandibular gland separated by the mylohyoid muscle. So after knowing the position and the parts of the gland, we will try to see the relations of the gland. First we talk about the relations of superficial part. This is the superficial part of the gland. What are the relations for the superficial part? Anteriorly, this part is related to anterior belly of digastric, and posteriorly it is related to the posterior belly of digastric and stylohyoid. It is very simple to understand and you can even clearly see in the image. I will try to give you the orientation of this image. Here the submandibular region is exposed by removing the mandible, so that you are able to see the structures in the submandibular region. So here you can see the J-shaped submandibular gland. This part is the superficial part and this part is the deep part. Both are separated by the mylohyoid muscle. So in this slide we just discussed about the relations of superficial part. We will move on to the next slide. We will continue the relations of superficial part of the gland. Now we will see the medial relations. So these medial relations you will understand from three sections: horizontal or transverse section, coronal section and sagittal section. First we will begin with transverse section. So this is the J-shaped gland. We are talking about the relations of the superficial part, particularly the medial relations. What are the relations? First is the mylohyoid muscle. You can see the labeling. This is the mylohyoid. Next you can see what? The deep part of the gland. This is the deep part of the gland. Then you can see more deeperly, you can see deeper plane, you can see what? Hyoglossus muscle. This is the hyoglossus muscle. We will see again in same in the coronal section. This is the coronal section. Here you can see the mandible. Here this is a depression which is called submandibular fossa, where you can see the position of your submandibular gland. Particularly this is the superficial part. We are talking about the medial relations. The first one is the mylohyoid. I am pointing the mylohyoid. Next you can see what? The deep part of the gland. Next, most medially you can see a muscle which is hyoglossus. This is hyoglossus. In addition, you can also see the nerves and a ganglion medially, that you will understand in sagittal section. This is the sagittal section. Here you can see the mandible. This is the mandible. This is the hyoid bone. So here the mylohyoid muscle and the superficial part of the gland is removed to expose the deeper medial relations. So what I can see here is the hyoglossus muscle. This is the hyoglossus. Superficial to the hyoglossus muscle there is a portion of the gland. This is the deep part of the gland. This is the deep part of the submandibular gland. Above this there is a nerve called lingual nerve. From here there is a structure hanging. This structure is submandibular ganglion. Below the deep part you can see another nerve, which is the hypoglossal nerve. So medial relations include more deeper plane, two nerves, lingual nerve and hypoglossal nerve, and the lingual nerve is associated with submandibular ganglion. Hope you understood. So in this slide we will try to see the lateral relations of superficial part of the gland. So this is the coronal section. So in the coronal section you can see this is the superficial part. We are talking about the lateral relations. What are the lateral relations? The submandibular fossa of the mandible and the facial artery. So these are the two important relations situated lateral to the superficial part of the gland. Hope you understood. After knowing the relations of the superficial part, now we will move on to the deep part. So the deep part of the gland, as you know, it lies deep to the mylohyoid. See, this is the mylohyoid muscle. The deep part of the gland lies deep to the mylohyoid muscle. Now we will try to see the relations of this deep part by using horizontal section and sagittal section of submandibular region. So in the horizontal section you can make out the lateral relation and medial relation. So obviously laterally it is related to mylohyoid muscle. Medially it is related to hyoglossus. Now in the sagittal section you can understand in its upper and lower relation. I mean to say the deep part above it is related to lingual nerve and ganglion, submandibular ganglion. Below it is related to hypoglossal nerve. Hope you understood the relations of a deep part with the help of horizontal section and sagittal section. Submandibular duct. It is also called Wharton's duct. It begins from the deep part of the submandibular gland and then finally it opens in the floor of the mouth. This is the course of the submandibular duct and it is opening in the floor of the mouth. Exactly where in the floor of the mouth? I can show you here. So in the mouth the tongue is connected to the floor of the mouth by a structure called frenulum. You know it already. So the opening of this duct is seen close to the frenulum. On either side it is situated close to the frenulum. The area where it is opening, the mucous membrane shows elevation which is called sublingual papilla. It is called sublingual papilla. Now if you see the course of the duct here in this picture, this duct is very closely related to the lingual nerve. So while performing any surgical procedures on the submandibular duct, there is a chance of injury to the lingual nerve. So you should take care of the lingual nerve while performing the surgeries of submandibular duct. The arterial supply for the gland, it comes from the two arteries which are closely related to the gland. They are the lingual artery and facial artery. You can see lingual artery here and you can see the facial artery here. This is the coronal section and this is the sagittal section, as you know. And the venous drainage to the corresponding veins and finally drains into internal jugular vein. The lymphatic drainage, obviously the lymph will drain into submandibular group of lymph nodes. From there it will go to deep cervical group of lymph nodes. And submandibular group of lymph nodes, usually they enlarge when there is a infection in the teeth, face, scalp, oral cavity and maxillary sinus, because in addition to the submandibular gland, it also receives lymph from all these areas. So these lymph nodes will enlarge when there is an infection in all these areas. We will move on to the next slide. Now we will discuss about the another salivary gland, which is the sublingual gland. This is the smallest of the three salivary glands. You can see the position of sublingual gland here. Where it is located? It is located in the floor of the mouth, deep to the mucosa. If you see the position of this gland from this figure, you can understand clearly the relations. We will talk about the relations. Above or superiorly, it is related to the mucosa, obviously the mucosa of floor of mouth. Inferiorly, it is related to mylohyoid muscle. Posteriorly, it is related to the deep part of submandibular gland. Laterally, it is related to sublingual fossa of mandible. What is this? I will try to explain. This is the mandible, as you know. It has a ramus and body. The body, the internal surface, there are two depressions. The depression in the upper part, depression or a fossa in the upper part is called sublingual fossa, which is little small. In the lower part, in the internal surface of the body, you can see a bigger depression, which is submandibular fossa. So the sublingual gland, laterally it is closely related to the sublingual fossa of mandible. Medially, the mandible is related to a muscle, which is the muscle of tongue, called genioglossus. Secretions from the sublingual gland carried by the sublingual ducts. Unlike submandibular gland, the sublingual gland possesses many ducts. Each gland may possess around 8 to 20 ducts. All these ducts open directly on the floor of the mouth, but few of them may join the submandibular duct. As you see in the picture, some of the sublingual ducts are joining the submandibular duct. Otherwise, majority of them, they open directly into the floor of the mouth. Now supply of submandibular and sublingual glands. As you know, the exocrine glands are supplied by parasympathetic and sympathetic nerves. The parasympathetic nerves are also called secretomotor nerves because stimulation of these fibers causes a release of secretions from the gland. That is why parasympathetic fibers or nerves are also called secretomotor nerves. First, we will begin with parasympathetic nerve. As you know, the parasympathetic nerve consists of two components, preganglionic fibers and postganglionic fibers. The preganglionic parasympathetic fibers, they begin from brainstem, particularly from a nucleus called superior salivatory nucleus. Where it is located, you will understand better when you do in the later semester. Time being, remember the fibers begin from superior salivatory nucleus of brainstem. Then fibers will pass through the facial nerve, then through a branch of facial nerve called chorda tympani. This chorda tympani then join with the lingual nerve. I mean, the parasympathetic fibers from the chorda tympani pass through the lingual nerve. and finally reaches the submandibular ganglion. Submandibular ganglion, it is a parasympathetic ganglion where you can see the cell bodies of postganglionic parasympathetic fibers. From this ganglion, or you can say the cell bodies, the fibers will directly reach the submandibular gland and sublingual gland. I will try to trace the parasympathetic nerve from the figure here. Here you can see only the cauda tympani, because the facial nerve has a course through the ear. Then when it is passing through the ear, it gives a branch called cauda tympani. You can see here. So the fibers pass through the cauda tympani. You can see the labeling here. Then they pass through the lingual nerve. After passing through the lingual nerve, the fibers reaches the ganglion. This yellow color structure here, you can see the submandibular ganglion. From there, the fibers will reach the submandibular gland, and some of the fibers will run along with the course of lingual nerve and finally reaches sublingual gland. This is the parasympathetic nerve supply of the submandibular and sublingual gland. What about sympathetic nerves or sympathetic fibers? The sympathetic fibers also have the two components, preganglionic fibers and postganglionic fibers. The preganglionic fibers, as you know, they arise from lateral horn cells of spinal cord. Then they reach the sympathetic ganglion, which are located in the sympathetic chain. From there, the postganglionic sympathetic fibers, they reach the submandibular and sublingual gland by passing along with the facial artery and lingual artery. So the postganglionic sympathetic fibers, they reach the gland by passing through the facial artery and lingual artery. We will see the applied anatomy related to the submandibular gland. Submandibular gland stone or cyalolith, they are the calcified masses generally found in the parenchyma or the substance of the gland. Sometimes they are also found in the duct of submandibular gland. So when they are found, they have to be removed. There are various factors associated with the stone formation. We are not going to the details of it. Timing, remember what are those and where they are found. There is a radiographic procedure called cyalography. By using this procedure, you can see the duct system of the submandibular gland. I will briefly explain the procedure. So in this procedure, they inject the radiographic fluid through the opening of the submandibular duct at the floor of the mouth. After some time of injecting the fluid, they will take the radiographic images and they will observe the duct system. If there is any obstruction, as you see in this image, there is obstruction in the duct, due to which you cannot clearly visualize the small ducts of your submandibular gland. The procedure is called cyalography, and the images that you get in this procedure is called cyalogram. So it is mainly used to detect any obstruction in the duct system of submandibular gland. Hope you understood about cyalography procedure and its importance. Submandibular gland excision. As you know, the word excision means removal of the structure. So when usually submandibular gland is removed, when there is a inflammation, chronic inflammation of the gland called cyalodentitis, or when there is a big stone within the parenchyma of the gland itself, or when there is a tumor in the gland. In all these conditions, the gland is excised or removed. So when you do the procedure, the incision in the submandibular region should be given 2.5 centimeters inferior to the angle of the mandible. You know, this is the angle of the mandible. The incision should be given approximately 2.5 centimeter below it in order to preserve an important nerve which runs very close to the base of the mandible. The name of the nerve is the marginal mandibular nerve, which is a branch of facial nerve. I will repeat. While performing the procedure of submandibular gland excision, the incision in this procedure should be given 2.5 centimeters below the angle of the mandible in order to preserve the marginal mandibular nerve, which is a branch of facial nerve. Ranula, it is a type of mucocele or mucus filled cyst which is found on the floor of the mouth. As you see in the picture, there is a mucocele and this condition is called ranula. Usually this condition results from an injury to the duct of salivary gland. Following an injury, the saliva will escape from the duct and it will get accumulate deep to the mucosa and forms a cyst, and such condition is called ranula. Nerve supply of parotid gland. This has been already explained in the introduction to anatomy course. So I brought this here. It is to revise on your own. Both sympathetic and parasympathetic nerve supply. In this image you can understand clearly the sympathetic and parasympathetic nerve supply of parotid gland. Now we will talk about the three important nerves that you see in the submandibular region. First we'll begin with the lingual nerve. As you see in the picture, the lingual nerve, it goes very close to the lower third molar tooth, lying superficial to the hyoglossus muscle. This point I have shown you when we discussed about the relations of submandibular gland. Then the lingual nerve, it winds around the submandibular duct, you can see, and finally it reaches the tongue for the sensory distribution. What are the branches of the lingual nerve? It gives sensory branch to the tongue through which it carries general and taste sensations from particularly anterior two-thirds of the tongue. Remember, the taste fibers passes through the chorda tympani, but the fibers of this chorda tympani runs along with the lingual nerve. It also gives ganglionic branches which directly supplies submandibular and sublingual gland. What is lingual nerve? Where it arises from? We will discuss in the coming lecture of infratemporal fossa. Here I am explaining only the course of the lingual nerve and its branches in the submandibular region. The course of the lingual nerve close to the third molar tooth is very important while performing the tooth extraction procedure, because this nerve frequently injured in this procedure. So when there is a lingual nerve injury in this procedure, there is a loss of general and taste sensations from anterior two-thirds of the tongue, and also the secretory activity of the two salivary glands will be lost. So while performing tooth extraction, particularly the lower third molar tooth, you should take care of lingual nerve. We will move on to the next nerve, the hypoglossal nerve. As the name suggests, it has a course below the tongue. As you see in the picture, this is the tongue. Below the tongue you can see the hypoglossal nerve. So the hypoglossal nerve, it is the 12th cranial nerve. In the submandibular region, it lies superficial to hyoglossus muscle below the submandibular duct, you can see in the picture, and it gives following branches. First we'll see the muscular branches. You know it already. It supplies all the muscles of the tongue except palatoglossus. This palatoglossus is supplied by the pharyngeal plexus, particularly accessory cranial nerve. It also gives a branch to supply the thyrohyoid muscle and also another branch to supply the geniohyoid. Even though the branches are coming from the hypoglossal nerve, but actually the fibers are C1 spinal nerve. You can see from here. So this is the hypoglossal nerve, the 12th cranial nerve. It goes all the way to supply the tongue, but on its way to the tongue it gives two branches to supply geniohyoid and thyrohyoid. But these two branches consist of fibers from C1 spinal nerve. Hope you understood. It also gives a branch. This you have seen already in the introduction to anatomy. The name of the branch is called superior root of ansa cervicalis. Here you can see the superior root of ansa cervicalis, and it consists of again fibers from C1. This is the course and distribution of hypoglossal nerve. Hypoglossal nerve injury causes atrophy or wasting of affected side tongue muscles. When a patient with hypoglossal nerve injury protrude the tongue, in this patient, after protrusion, the tongue will deviate to the affected side. This is due to the action of opposite genioglossus. I will explain this from the picture here. So here you can see a patient protruding the tongue. After protrusion, there is no deviation of the tongue, so there is no hypoglossal nerve injury in this patient. Now we can see another patient here. So here after protrusion in this patient, the tongue is deviated to one side. So by looking at this, you can confirm that this patient has the right hypoglossal nerve injury because the tongue is deviated to the right side, which is the affected side, and this deviation is due to the contraction of left side genioglossus muscle. This is how you conduct test for the hypoglossal nerve injury. I will repeat the test again. If a patient comes to you with hypoglossal nerve injury, you will ask the patient to protrude the tongue. So by looking at the deviation, you will confirm the result of the test. This is a schematic picture again to explain the hypoglossal nerve test. It is a self-explanatory. I already explained in the previous slide. Please revise. Glossopharyngeal nerve. It is located deep in position in the submandibular region compared to other nerves. It always accompanies or runs along with a muscle called stylopharyngeus. You can see the labeling of the muscle in the figure. And when you look at the distribution, it gives a carotid branch. This we discussed already in the first lecture of face and scalp, where this branch will go and supplies carotid sinus and carotid body. It gives a muscular branch obviously to supply the stylopharyngeus muscle, and it gives a lingual branch, you know this already. It supplies the posterior 1/3 of the tongue and also the circumvallate papilla, which is there in front of the sulcus in the dorsum of the tongue, and gives pharyngeal branches which forms the pharyngeal plexus through which it carries sensations from oropharynx. Glossopharyngeal nerve lesion or injury. This results in a loss of gag reflex. I will explain gag reflex later in pharynx lecture. And there is a loss of general and taste sensations from posterior 1/3 of the tongue and palate, and there will be loss of general sensations from oropharynx. The loss of secretory activity of parotid gland, because the glossopharyngeal nerve branch called tympanic branch carries the preganglionic parasympathetic fibers to the parotid gland. This you can revise from the nerve supply of parotid gland. So with this we completed the lecture.